Thank you for joining us for our weekly Wednesday media briefing here in Montgomery County. We have our usual set of speakers today: County Executive Marc Elrich, our County Health Officer, Dr. Travis Gayles, and our Director of the Office of Emergency Management and Homeland Security, Dr. Earl Stoddard. And all three will begin our media briefing today with a few remarks. And let's begin with the County Executive.
Good afternoon, everybody. Have just a few things to say today. Our new cases today totaled 73. It brought us up to 16,593. We had 2 additional deaths. In terms of the state in general, 56% of the new cases are coming from the Baltimore metropolitan area, and 11% of the new cases are under 19 years old. It wasn't that long ago when over half the cases were coming from Montgomery County and Prince George's County, so this is a real shift in where the cases are coming from, and there's also a shift in the ages. And I'm sure Dr. Gayles can talk more about that as we go on. The county has tested about 12.9% of its population. The state's tested 13% of its population. We had 3,900 tests reported in this morning, and so our cases, 73 cases we had are out of the 3,900 tests that we had in. And I'm sorry, my thing is doing that. Our 7-day test positivity is 3.3%, and for the day it was 1.9%, and the state positivity is averaging 4.5%. And if you take all the tests that we've conducted in Montgomery County, it's 166,000, roughly 600 tests. So that gives you an idea of the number of people we've tested more than once. So while our county is plateaued, and you'll see, if you look at the data, that we've been relatively flat. We've been relatively flat, I guess, for 2 or 3 weeks now. So we came down from numbers that were significantly higher than this, and then we've hit this plateau. Our goal is we've got to drive this down so that we start declining again. So the good news is we've plateaued and we're not on that steep slope running upwards, but it continues to be an issue as long as we can't bring the cases down. And to do that, we're increasing the number of tests we give. We're testing more broadly in the community. We're partnering with community groups that may have better access to some hard-to-reach communities than the county government normally has. We're looking at a variety of different ways of expanding our reach so we can test more people and get a better understanding, or at least get better verification of where the positive tests are coming from, so we can more effectively tamp the number of our cases down. Our testing is available to everyone. No doctor's order is needed. You don't have to be sick. It's free if you don't have insurance, and it no longer includes the painful nasal probe. It's now, they're using mouth swabs, spit tests, and nasal swabs, none of which have the uncomfortable elements of the original test that was being used. We encourage everyone to get tested. You can sign up on the county portal to get tested. You can do walk-in at our sites to get tested, and we're adding more sites on a regular basis. We have ready responders available again to actually go to households individually in the hardest hit zip codes. But the 3 things that we're going to continue to emphasize with everyone is wear a mask, wash your hands, and get tested. The fact that we got ourselves to a place where we're at least flat has everything in the world to do with how the public responded to these 3 requests. We've had pretty high compliance on mask wearing and on washing your hands and getting tested. At least we're assuming washing your hands. We're not there to see that. But we know our test numbers are up, and we see people wearing masks. These are the things that enable us to get more control over the infection. And as long as the people who are listening and the message goes out to the community that you're doing the right things, it's the community that's ultimately responsible for having been able to get this thing under control to the extent we've been able to get it under control. And if people keep doing this, we expect that we will improve. And we certainly will not go down the path of other jurisdictions, but we continue to be worried. We're to live in a very fluid place. It's not unusual to go to Baltimore, to a concert or go out to dinner. It's not unusual to go to Northern Virginia and DC. So we're all connected with everybody else. And so when we see spikes around us, we're aware that it could be Montgomery County residents traveling to places that have these spikes, and then unbeknownst to them, coming back to Montgomery County and bringing potentially the virus with them. So we're very aware of what's around us, and we're encouraging people to be safe. Don't do in another county what you wouldn't do here. If you see people not wearing masks in situations in other jurisdictions, it does not mean that you too should not wear a mask. You should continue to do the most protective things that you can do. I'll also add, we're looking at the pop-up centers, and today we have one at the Oakdale Church in Olney. And I think I'll stop there and let people, one other thing I will mention, we are enforcing on businesses, and we had 5 citations over the weekend. Most businesses are doing exactly what we need them to do. And we're really happy to see that. But we are aware of, when we become aware of businesses that aren't doing what we need them to do, they're getting warned, and then they're going to be shut down. So hopefully everybody would rather do some business and do it the right way than not do any business at all. We hope people continue to choose to comply. And then at that point, I'll stop. So thank you.
Thank you. Dr. Gayles.
Good afternoon, everyone. I hope you can hear me okay. The county executive outlined our latest numbers, including a plateau in our daily case average. And this is in the setting of seeing increases in cases in other jurisdictions in the state and continued increased cases in over 40 states across the country. Our test positivity rate, as we have tested more people, continues to go down. It's now at, I think it's 3.27% today. But as you pointed out, we continue to be concerned because there are, jurisdictions that do see increases in cases, and we have to be mindful of that and continue to monitor what that means and what the impact of that is on our community. Now, a couple of things I do want to highlight and save time for questions. There's been lots of questions about, well, what data are we using to drive our decisions? We're continuing to look at the data dashboard that open and accessible to the public, and particularly as it relates to young folks, as MCPS announced this week that they would be all virtual during the fall. The reality is, when we look at where we are, as the county executive pointed out, we've made tremendous strides to get to the point where we're averaging 70 cases a day. But to level set where we are right now, when we made the decision to close schools because we thought it was an increased risk for kids and staff members, and when we made decisions to close down large segments of our population, can you guess what the 3-day average was back then in mid-March? It was 4 cases a day. So we've made a lot of progress, but we still have a long ways to go before we can make sure that we can open up any other aspects of our society, whether we're talking about schools, athletic venues, those kinds of things, because we need to see the burden of the virus drop even more so that we can feel that when we do open up and make provisions for those things, that we can do so safely and minimize transmission. The last thing I want to highlight that the county executive also mentioned is we've seen a shift in cases from the National Capital Region to other areas of the state. But more importantly, we've seen an increase in the percentage of cases in our young people. And I know some folks say, well, young people get it, they're asymptomatic, they may not transmit it, or they may not have symptoms. But young people interact with their family members. They interact with their parents, their grandparents, and even if they are asymptomatic themselves, they do carry a risk of exposing others within their households and networks. So we have to be vigilant, not just for our older segments of our population. We've got to be vigilant for everyone. And as that percentage increases, now I think those under the age of 19 make up approximately 10% of new cases. We've got to drive that down even more. Because again, we want to make sure we minimize transmission as much as possible. I'll stop there and happy to answer any questions that you all may have.
Thank you, Dr. Gayles. Dr. Stoddard, if you have any opening remarks, go ahead and let's do those now, and then we'll open up the floor for all of our speakers.
I do have just a couple comments, and I want to add to what Dr. Gayles just said. As we think about the school system, it's not just the students that we have to think about, it's the faculty and staff that work in those buildings as well. Those residents matter as much as our children do. Many of them are older, many of them have underlying health conditions that have to be considered as well. And so it's not just, there's a balance of issues that have to be considered, and the safety of all those involved in the education system is important. I do want to talk about the extreme heat a little bit. We obviously have had cooling centers open throughout the county as this extreme heat event has continued. We don't expect to get to quite 105 today, but there is a heat advisory that tells us we're going to get close enough. We want to keep those cooling centers open. They have been mostly lightly utilized, but obviously with the option of having our free ride-on bus service and water on those ride-on buses, I think people are utilizing multiple different avenues to try and keep cool during this event. I'm not aware of at this point, because I'm sure this will be asked, any heat-related fatalities. We'll continue to monitor that. Sometimes those come later when you see autopsy reports and other things like that, but we're not currently aware of any at this point. The county executive already talked about the education and enforcement program. We're utilizing our Montgomery County Safety Alliance. There were 5 citations issued over the weekend for things related to not meeting the physical distancing requirements, face coverings, and the smoking of hookah in some of our establishments, which is not currently permitted. And so those were the core issues related to those. There were no closures. There were some, where we cleared out an establishment because they were just too packed. And so those did occur, but no facilities were closed. The vast majority of facilities and businesses continue to comply. We have seen an uptick in compliance as we've done additional enforcement and education. The state has recognized those efforts, and I know the communications director for the governor is listening to this right now because I tweeted about it already. And so we very much support our neighboring jurisdictions doing increased enforcement and education because it helps everyone out, and no one wants to go backwards. No one wants to have to do what Baltimore City has to do, which is end their indoor restauranting. We don't want to go down that road, but if we see the same uptick in cases, that's something that Dr. Gayles and the county executive would have to consider. And so we're trying to avoid that. We want compliance to ensure that we don't need to go down that road. The last thing I want to touch on is the eviction note issue. Obviously, we know that the moratorium is scheduled to end on July 25th, which is Saturday. We know that there is a backlog of evictions that predate COVID that will likely be the first things in the court systems. And so the COVID-related evictions, we do know we would expect to see sometime in August of September. We did submit over, and the council has introduced a $20 million allocation to address the beginnings of eviction prevention, but we know that number is wholly insufficient to address the eviction problem in Montgomery County. We are certainly hopeful that there will be additional state and/or federal support in the eviction arena. This was the hard work of our homelessness and eviction prevention work group within our county COVID-19 recovery framework. That includes participation from our Renters Alliance, our AOVA, which is our business, our property management companies, the county, and others to try and come to a holistic proposal that would address both the concerns of landlords and tenants as well. And so obviously that's a key thing we're going to have to continue to monitor moving forward, but obviously this first step towards addressing that problem will allow us to both build a system that can address it if and when additional resources become available, but also to try and address the real beginnings of this problem. The key thing that we're focused on is eviction prevention. Obviously, this isn't just to try and keep people in their residences for a couple months and have them be evicted later. So we're really trying to work with landlords to try and address the question of how do we keep people in housing and prevent homelessness moving forward. So I'll stop there.
Thank you, Dr. Stoddard. We're going to begin today with Robert McCartney of the Washington Post, who has a question regarding the federal government. Go ahead, Robert.
Hi, thank you. Yes, I have a question for Dr. Gayles and Dr. Stoddard. Dr. Gayles said yesterday in the briefing that he thought that personally he favored a national mask mandate. And I'm just wondering, what are like the 2 or 3 steps that the federal government or conceivably the nation's governors could adopt to sort of help deal with this crisis? What are the 2 or 3 specific things they could do at a national level as part of a national strategy to try to fight this thing and make your guys' jobs easier? I mean, would it be coordinating PPE? Would it be, I don't know, money or coordination for testing or tracing? What do we really need more of from the federal government or the nation's governors working together to deal with this? Thank you.
You want to start, or I can? Either way.
I'll start. This is a follow-up from when Bob and I talked yesterday in our press briefer. So I think a couple of things. I think there has to be a national strategy, period. There just has to be a national strategy, period. And inclusive in that is a national testing strategy that work to increase access to testing and help support build lab capacity, because as you know right now, one of the challenges is many of the private laboratories who are processing the kits, as we increase testing, they're backlogged because they're overwhelmed. And so a national strategy that provides support for those laboratories, as well as space to support other labs being able to get up to speed to match the capacity and meet the demand. As you mentioned, PPE is significant. So there's 2 components of that. The first one is we have to have national provisions, and forgive me, I'm blanking on the federal act. I think it's the National Production Act that increases capacity to make PPE. We should not have shortages of gowns, gloves, masks, and things like that, because we've been at this for over 4 months now. We know the need, we can anticipate the need. I see it's the Defense Production Act, yes. So the Defense Production Act would increase production of those supplies. And then on the flip side of that is having a national strategy for distribution of those supplies to different jurisdictions that are objective and standardized and not based upon politics. I think the third component of that would be a national surveillance and data platform that allows us to be able to continue to track evidence of cases, again, and it's not informed by politics. As we've seen in a number of states, they've misrepresented data. We've seen senior data officials fired for different reasons. But if we had a national strategy and a national platform that allowed us to follow that is run by public health officials and epidemiologists and not political folks, that would allow for us to be able to follow this in an objective measure, be able to respond and react to outbreaks or surges in cases in a much quicker manner.
Dr. Stoddard, did you want to add on?
Yeah, I just want to add one point is, the one thing the federal government is really good about being able to do is create a strong demand. They can create demand in a way that the state and local governments cannot. So what that means is, so if you're a private lab provider and you're not certain what the future of COVID-19 is, you're sitting here in March trying to predict what the future is. Do you invest millions or billions of dollars in building out infrastructure if there's no guarantee that that infrastructure is actually going to be utilized and your investment's actually going to pay dividends? So the federal government can create by guaranteeing, saying, if you do this now, we'll guarantee you that we'll recoup your costs plus some reasonable percentage if we don't utilize the infrastructure that you've built out. And so instead of the company taking the risk, now the federal institution creates that buying power that allows that to happen, and then we aren't left in a situation where it's up to the individual laboratory companies to decide whether it's a reasonable investment for them to expand testing capacity or what. So that's the big thing that the federal government could have done early that would leave us in a much better position. It's what has happened in Europe and other other parts of the world, and it's frankly a large part of why we are where we are today.
Can I jump in on this one? Just quick. I mean, the other thing that we didn't talk about is leadership. I mean, the people out there who are pretending this isn't a problem and minimizing this problem, somebody like who sits in the White House, for example, until yesterday when he discovers there are masks out there, and it's like, if they give people a false sense of security, and these are people they trust, these are people who elected them, if they lead them down a path that's going to spread the virus because it doesn't suit their political agenda. This is just flat out dangerous. And people got to own that we've got a real problem. It's not a failure of any political party. It's not a failure of anything other than, we didn't have a health care system that was prepared to deal with this. And to, the points that, that Earl made, if you look back on this, when somebody does an autopsy or an evaluation of what America's response was, what you're going to find is that decisions were made on policies that were built on the scarcity of resources. And if there's any lesson that comes out of this, is you have to have the resources available so your policies can be implemented. To make a decision that you're only going to test people who traveled to a foreign country because all they could give us on a given day was 20 tests or 30 tests, that's crazy. That wasn't the governor's fault. It wasn't anybody's fault. But we need to make sure that we have the resources we need, not just for this, but for round 2 and for anything else that might come along. We've got to treat this as if we're prepared for a national emergency and we're ready to deal with it. That's the thing that to me is the most heartbreaking in all this, is having observed it, is knowing that we made decisions that were based on scarcity, not based on the policies we would have put in place if we had had the tools we needed.
Thank you. Randy with WDVM is up next with a question on testing for Dr. Gayles.
Good afternoon, everyone. Dr. Gayles, I know a lot of this is largely out of your control, but are you able to touch on the length of time it takes to get results back after someone gets tested? I've had residents tell me it's taken over 2 weeks in some cases to get a result, and that must make it difficult for those results to inform their decisions and their behavior. Are you aware of any efforts to help speed that process along?
Well, the extended length of time between test collection and results being delivered is influenced by part of what we just talked about in terms of capacity of laboratories to be able to meet the demand of the increase in tests. As you know, as you may have seen in looking at the news, we've seen increases of result cases in 40 states. And of those, in particular, 3 of our largest population centers, Texas, California, and Florida, have been hit the hardest. And so as they see more cases pop up, they're also testing more. And that increased demand has overwhelmed the private laboratory system, which has caused delays, as you said, sometimes, unfortunately, upwards of 10 to 14 days. That does create a challenge for us, and from the contact tracing perspective, in terms of, being able to get that result and do a follow-up interview. So what we're recommending is, as hopefully that window decreases over the next several weeks, and the time where in terms of when folks are notified is shortened, we are encouraging folks, particularly if you are a symptomatic individual, while you're waiting for your results, we're encouraging them to, again, quarantine and remove yourself from any networks of transmission to minimize transmission. And for asymptomatic individuals, particularly those who are known contacts of cases who've tested positive, we're encouraging and requesting that they quarantine themselves as well while they wait for their results to minimize any future transmission. Now, for the local laboratories that we've worked with, in particular to our self-collection mechanisms, we did see a little bit of a delay there as well. We've worked with the particular companies to get improvements in the technology and software to minimize that notification period. I'm hopeful that over the next week, we will see those wait times decrease. But again, for those who are waiting for those results who fall into those categories I mentioned, we would recommend they quarantine while they wait for their results.
Thank you, Dr. Gayles and Randy. Dr. Gayles, stay right there. Caitlin with Bethesda Beat has a question for you.
Hi, Dr. Gayles. Question for you, and the county executive can weigh in if you'd like. A lot of people in our community are frustrated schools aren't able to safely reopen while other activities are allowed, largely because they feel that those recreation type of activities are being prioritized over education, which is a pillar of our community or any community. They argue that we should be doing everything we can, even if it means reinstating some of those earlier restrictions to ensure that kids can get back to school sooner. From your perspective, would reinstating some of those earlier restrictions have the effect that these residents would hope for? If so, can you explain the rationale for why we're not doing that? And if not, can you please explain why not?
Well, you've actually asked a lot of questions, so hopefully I'll be able to get to them and break them down. I want to say first and foremost, again, we all value the nature of education. I don't think any of us, including the officials at MCPS or anyone would disagree that the value of in-person education is more beneficial than if folks are at home. That isn't a perfect world, though. Our world isn't perfect, and it's in fact it's heavily influenced by COVID in this setting, which guides us and determines how we will move forward. As I referenced, the decision to close schools was made when we were talking about an average of 4 cases a day. We're still somewhere between 70 and 80 cases a day, and in the particular setting where we're seeing increases in the percentage of young people who are impacted and infected with the virus. So these are the real world epidemiology and surveillance based realities that we live in as we try to negotiate and figure out these strategies as we move forward. Now, the type of experience and exposure in a school setting is different from some of those other activities. We have been very careful in terms of the activities that we have allowed, so to speak, in terms of our phases of reopening, to identify things that minimize risk of exposure, facilitate physical distancing, where we think they are lower risk in terms of type of exposure, duration of exposure, et cetera. When you're talking about school settings, you're talking about being in an enclosed indoor space around a number of people for an extended period of time. And so our colleagues at MCPS have drawn up lots of different scenarios and policies and plans that would allow for that to happen safely. But we're not at a point where the viral burden in our community is to be able to approve having those types of environments where there are extended periods of exposure, there are closer contact points, which do increase the risk of transmission for students as well as staff members.
All right, that appears to be our last question in the queue. Any closing remarks from any of our speakers today?
I just want to emphasize that, we talk, pretty much about the health impacts of all this, but I want people to know that we continue to urge the governor and to also our representatives in Congress to do something about financial assistance for tenants and frankly, even for commercial renters, because this week will be the end of the protection period unless the governor does something different today. And if this ends the protection period, then shortly the eviction process will ramp up. And even though we put $20 million aside, we know that $20 million is not going to be adequate to deal with this, and that we really need more state assistance. The state assistance, when spread over the whole state, amounts to very little from Montgomery County. Our proportionate share would not drastically alter what we're able to do right now. We need a willingness from all of our partners to put the money into this so we don't have massive displacements in the community. That will only make things worse, whether you're looking at it from the lives of the people who will lose their housing, or if you're looking at it from the businesses that will make a very difficult decision not to reopen if they feel they're going to be asked to pay or forced to pay the back rent. The closing of those businesses, the prolonged closing of those businesses for no other reason than back rent when they could open and they could put people back to work, would just complicate and extend this economic disaster that we're dealing with. So I'm hoping that people can put aside partisan differences and not worry about political points and think about what would it cost to make sure that that as we try to reopen, that businesses can do it successfully, that people have some security in their housing, and that we work on solving this problem the way you'd work if you were fighting a war or trying to recover from a hurricane, that you wouldn't be nickel and diming everything. You'd be thinking about what do you need and what do we have to do to make this thing work. And we need that commitment at both the state and federal level. And
that vote, Mr. County Executive, on the additional $20 million for eviction prevention is set for next week. Is that right? Okay.
Yep. And I'm sure it will be a 9-0 vote.
Well, I think that's it for today. We appreciate everyone joining us. And next week, we will be meeting on Thursday. We will have to rename our weekly Wednesday media briefing, or at least for the week. We'll see you next Thursday. We'll send out a media advisory with the specific time. But until then, stay safe, stay healthy. Thanks for joining us.
Thank you all.